So the new Battleground Tracker survey is out, and we know, for example, Democrats, they don't like the president. They've got plenty of options. But what is it actually that they find most important, and what is the issue they want to hear the most from candidates about? Well, according to our data, it's health care. And frankly, if it could be the second and third choice, it would be health care and health care again. It's such a huge issue of concern this time around. I'm Ed O'Keefe, political correspondent for CBS News, joined by Anthony Salvanto, our director of elections and surveys. And healthcare is the top policy concern of Democratic voters.
It is, number one. And, you know, full disclosure here, we talk even before we're doing the polls, and you tell me what you're hearing out there on the campaign trail, and you hear people talking about healthcare. Lo and behold, it comes back, and voters in the polls telling us the same thing. But you know what, Ed, what strikes me is it's not just healthcare per se. We ask specifically, what is it about healthcare that concerns you? And what really pops out is people saying it's cost. It's their prescription co-pays. It's their prescription costs. It's their co-pays to go to the doctor. It's the person standing in line who has to make a decision and going, oh, wait, I can't afford that medicine. So it's the cost of health care, even if folks have insurance. And so when I hear that, see that in the polls, you look at the candidates talking, and are they talking about costs, or are they talking about access and coverage?
And they're still talking about access and mode of delivery. It's this argument over, do you preserve the Affordable Care Act and possibly tweak it? Or do you abandon it entirely and go to something called Medicare for All? Or do you do some combination of the two? And then there's a debate about how you pay for the system, not how Joe and Jill American would pay for their health care. And what's telling is that this data is telling these candidates, you're talking about this the wrong way.
Yes. In fact, we asked people, what do you think the Democratic message ought to be going forward into 2020? Not just what you want, because, you know, voters have been trying to game out this process, looking to 2020 for a while. And they say they think the Democratic message should be about costs rather than about coverage. Having said that, there's also this split among Democrats about the things that you just mentioned. Ought there be a Medicare for All program, and whether it should be a replacement for private coverage or whether it should just compete alongside with private coverage. And you see more Democrats saying, wait, let it compete with private.
Right.
Don't take away private.
And don't the numbers also show that a plurality are in favor of Medicare for All, but the second block is it depends on how much it would cost. So the it depends is second, but it's sizable, and that speaks to the argument that someone like Joe Biden has been making, which is, okay, you want to do this. Well, how exactly are you going to do this? Or as Pete Buttigieg told me last week, any candidate who talks about Medicare for All is obligated to explain in the next sentence how it would happen, when it would happen, and how it would be paid for, which speaks to the roughly 37% of Democratic primary voters who said, it depends, explain to me how much this costs.
Right. And, you know, little polling, best kept secret in polling is, it depends is really more like real life than the boxes and choices we often, you know, give to people. Yeah, that's what you want. But the it depends part covers all the different parts of this, in the sense that we then ask people, well, what would constitute how you'd pay for this in terms of raising taxes on the wealthy, which is what a lot of the candidates say that they would do. And you get this distribution of what people think is wealthy, over 100,000, over 250,000, over $1 million, and there's different views on that too. So you see that the it depends becomes really down to dollars and cents. Well, wait a second, just who is it that's wealthy and who is it that's going to be paying for this really matters in terms of what they think.
And is there anyone emerging in this data as the healthcare candidate?
It's a split because Joe Biden does relatively better, although all the top tier candidates are in the mix, among the folks who say keep private insurance, let Medicare for All compete if it happens. And Warren and Sanders, and to a certain extent Harris, do relatively better among those folks who say replace private insurance, let's definitely have Medicare for All.
Did we ask in this survey how the president fares on health care?
No, this one's about Democrats.
Right. So in the past, his measurements on health care have been
about where they are with everything else.
Right.
About where they are with everything
disapproval, beating approval.
Yes.
But it might explain why we've seen him, the White House, Republicans in general, talk about affordability in the last few months. There was this push toward lower drug prices, which has been thrown out in court, saying, you know, prescription drug companies don't have to reveal their prices in advertising. That's responding to similar polling that shows that people are more concerned about the cost than the actual way they're getting their insurance.
And he'll also know that coming out of the 2018 midterms, where, of course, his party lost seats, You saw health care also the #1 issue, but also a fear among voters in Republican territory and Democrat that pre-existing condition protection would go away. And I think that's the next thing that folks are going to start talking about when they hear what health care means in terms of specifics.
Yeah. Well, you can dive into the details of the questions over healthcare, immigration, climate change, criminal justice reform, and who exactly is winning right now, even though we're about 7 months away from actual votes being tallied. All of that at cbsnews.com. I'm Ed O'Keefe in Washington with Anthony Salvanto. Thanks for watching.